Hi everybody, my name is Erica and I'm going to go over everything I bought for my gastro bypass surgery that I'm going to have in March 27th of 2014. So I'm going to show you everything I have, I bought today, okay? So first I bought this fish oil. It is orange flavored, and they say it's coated, I guess that's what they call it. So if you can see closer, all the nutrients it has, and the front, and I think it was like $36. Then I got this iron because you need iron. I think it was, I don't know, like $27. These are what it has, all the vitamins and everything. Then I got this liquid vitamin B complex. This is what it looks like. These are all everything it has in it. And this is the liquid calcium. And this is everything it has in it. I don't know if you can see it, but this is the multivitamin I got in liquid too. And this is what it has. And I got these biotin for your hair and your nails and your skin. The dots. This is what it looks like as well. It has little pills. And this is what it has. Can you see? Good. Okay. Vitamin D as well. I got the same. The Twin Lab is pretty good. They specialize in, I guess, gastro bypass patients. Vitamins. This is vitamin B12. The same thing. There's like 5,000 milligrams in there. Protein shake. I have a chocolate one downstairs, the same brand. I bought this one because it has antioxidants. So if you can see the front. And this is what it has, if you can see. And I bought this for the protein shakes. I guess it mixes it inside with a little ball. And if I'm not explaining everything correctly, this is my first time and this is my first video, so I'm kind of shy and I feel funny. If you have questions, you can ask me and I'll explain everything to you later. And I'll let you know exactly how much I spent on everything if you guys have questions. I also bought everything at the vitamin, what is it called? The vitamin store? What vitamin store is it called?
Vitamin Shop?
The Vitamin Shop, yes, thank you. So I went and I bought all this other stuff at the dollar store because I didn't want to, you know, it's $1 for like 4 little cups. For little, like children-sized cups. These are 4 little ounce bowls. So you can have your chicken broth or whatever it is after surgery. So there's 3 of them for $1. I bought this Minnie Mouse. I could put nuts or snacks or whatever later on. I bought this cup. This one is 36.5 ounces. No straws because you're not supposed to drink out of a straw anymore. So I bought that one. And I got this one for the water as well. 28.5 ounces. I bought the little bowl. And I bought this plate. So there's like little separations, so I could put like chicken here and put beans or whatever. And if I want some soup, I have some here.
Go.
Okay, so here are some baby spoons or kid spoons and forks. I also have some spoons that I bought downstairs, but they're like the baby ones, the size of this. But I'll show them to you later. I bought measuring cups. This one came with the measuring little cups and the spoon, which was good, and it was for $1 instead of buying them separate, which I thought was good. I bought this. I thought I would need it. I don't know for what, but I bought it. Maybe for my medicine, for the vitamins. It has like the little measuring stuff, or maybe for soup, if I need to get the soup without, like, if I make like a broth with meat. I could use it, I guess. And I bought these so when I go anywhere, or I could put the soup or vegetables or whatever I need to stack on in these. And I bought these little ones so I can make like little jello shots, almost like, because you can have jello, and my stomach will be the size of an egg, so this is a pretty good size. This will probably fill me up. So that's basically what I bought today. I totally forgot to get fiber liquid. The liquids to me are better because they said that you get really full off of the little tablets. These ones are really tiny, so I'm hoping that they'll be fine. But the bigger ones, they said that you're going to get really full and you probably get sick. The chewable ones, so I just decided to get liquid. So everything is liquid. Once I open them, they told me to put them in the fridge. So if you do buy or decide to buy the liquid, once you open them, you should put them in the fridge. And so I need the fiber. I need the what is it? The nitro bullet?
NutriBullet.
I'm going to go buy that, and I'm going to buy a juicer. So that's the next step for me to buy. And then I wanted to explain to you, well, to everybody, why I wanted to start this journey. I've always been chunky my whole life, since I can remember. But a couple years ago I found out, well, maybe about 4 years ago, I found out that I have polycystic ovary syndrome, which is PCOS, and I have thyroid problems. So it's been always very hard for me to lose weight and keep it off. And stay steady. I've tried all the diets, everything that you can imagine, to diet pills, to Weight Watchers, to the Atkins diet, to juicing, to working out, and trying everything. I have lost weight, but for a little bit, and then I'll gain double the weight. So I finally just made a decision, because I'm a point away from being diabetic, and it terrifies me to get sick and to die. I mean, you'll die anytime, which is, I know everybody's gonna die, but just my age, I'm 28 years old, and it stresses me out because I'm not the way I used to be. I get tired easily, I can't sleep at night, I get very uncomfortable. It's just my health. My feet hurt constantly, my back kills me all the time. My heels hurt. I can feel like the bone. So I'm to the point that I'm tired of it. I'm sick of it, and this was like the best option for me. So I'm excited and kind of nervous in the same time, because I've seen so many videos and everybody's journey, and I've seen a lot of positive ones and some negative ones. So I'm hoping, I'm having the faith that everything will be good. So, and I just wanted to share this with everybody because I know that there might be people like me who don't really know or only hear some of the positives or only hear some of the negatives, and no one's really open. And I want to be open with everybody about everything. So, I've been like on YouTube all the time watching everybody's videos, and it's helped me a lot. I've been researching and basically looking at all the articles and looking at the pros and cons, because in the beginning I wanted to start with the lap band. I've had family who's had the lap band and have been successful with it. So I wanted to do that because I don't have any kids. So to me, I was like, if I get pregnant later, I can open it and I'll be good, and then I can, you know, close it up again, and then I can diet again. But there's so many, I've seen so many people go from the lap band to the sleeve, and then go to the gastric bypass. And then people who've had the sleeve go to the gastric bypass. So, especially with what I have, which is the polycystic ovary syndrome, I'm almost like a diabetic. My insulin levels and the sugars in my body stay there. So I'm like insulin resistant. So I take metformin, which I don't know if it helps me. I don't know. I don't really feel the difference, but I'm tired of taking all kinds of medicine, for my cholesterol, to my metformin, to my thyroid medication, to my hormone pills or whatever, because my hormones are imbalanced, and I'm just tired of taking all kinds of pills and medicine. So I decided to do this. And
Go.
oh, it's on? Okay. So basically, that's it. That's my journey to where I am. And if you have any questions, feel free to ask me. Leave a comment below and subscribe. I will be making the videos throughout my whole process, and doing everything I'm supposed to. I mean, like whatever my journey is throughout this whole time. I also have done all the classes. I know that, you know, some of you who are planning to do this are going to have to do all the classes, and see the psychologist, and do some of your blood work. So if you have questions on that, I can, you know, try to help as much as I can. And like I said before, if there's any of you who have any tips for me who have gone through this, it would be greatly appreciated. And also for everybody else, if you have any questions, feel free to leave them below. Okay? Thank you. Bye-bye.